Hi Regina, how are you?
Good, how are you?
I'm good. Are you ready to go over our lesson?
Yes, I am ready.
So what's the lesson plan, or what's the unit we're going to deal with today?
So we are dealing with Unit 7, which is Understanding Safety and Infection Control.
Fantastic. So what's the focus for this going to be?
So I want students to understand the importance of general patient and employee safety in the
Okay.
healthcare setting.
Okay. So in the past, what have you done?
So usually PowerPoint they have a note sheet
Right.
that they fill out along with a PowerPoint presentation.
Okay. And then that's kind of it, or?
And then we will do some skills check-off
Okay.
based on what they learned.
Okay.
But that's how it's set up right now.
Okay. So I think what I was going to look at recommending for you is doing maybe some like Kagan strategies.
Okay, so
Um,
tell me about Kagan.
So it's more interactive. The kids actually, the way it's designed, it's a cooperative learning group. So you have kids that are stronger level to lower level that work together.
Okay,
We pair those kids up in a group, and they end up working, trying to come up with some solutions on their own. So I guess my first thing is we look through this lesson plan that I laid out, this chunking of learning. The launch piece, instead of going straight into the PowerPoint, what we'll do after we talk about how we group the kids together is have what is called stand up, pair up, and share.
okay,
So what they do, we'll have them stand up, hand up, and pair up, and then have them discuss something. And that's where you're the expert in this area. So what do you think that would be?
let's see, maybe how to protect yourself when caring for an infectious patient?
Okay, is that something they've done yet before?
No?
So this is going to get their mind thinking about what they're going to do if they get sneezed on or blood splattered on them or something.
Yeah,
Okay.
right. We want them to think outside the box.
Cool. Okay. And then after we do that, then maybe we could go into the PowerPoint, right?
Right.
Yes, because
Yep.
that would be more.
Then we're
ideal
gonna
when we get-
go more in depth into what that means and
Right.
some of the regulating bodies that kind of lay out our foundation of
Okay.
policies and procedures that we practice.
How long do you think that PowerPoint's going to take?
It could take one class period to probably two class periods total.
The PowerPoint itself? No, I mean, how long to go through the PowerPoint? Do you think it's going to take that long?
Yeah, it's
Okay.
about to split it up and be able to then do some hands-on learning to get through all of it. I would say two class periods total.
Okay. So if that's the case, if this is that PowerPoint's that in depth, maybe we could look at a Nearpod. Have you ever heard of Nearpod?
No, yes, I have heard of it, but I would like to learn more about it.
So with the Nearpod, it's a PowerPoint, but it's actually the kids are more interactive. I guess we would have to look at it and see if we want to do that. But either way, I would suggest instead of just going through a PowerPoint for two class periods, find spots in the PowerPoint where you want to stop
Yes.
and then check learning. One of the things that you'll need to do is pick spots in your PowerPoint to stop and then model what you want them to do. Does that make sense?
Understand.
Um,
So model the procedures that we want them to understand and know how to do.
Right,
Mhm.
exactly. And then after you do your modeling, I wouldn't go back into the PowerPoint. I would wait a while, not wait a while, but I would give them time to try it.
Sure.
Instead of getting through the whole thing. So you take me through it. What are they gonna have to know how to do?
So they need to understand infection control. So
Okay.
what PPE is, their personal protective equipment,
Which is
and
what?
then gloves, gown, mask,
Okay,
and understand the importance of those tools, and then we can demonstrate on how to put those things on and take them off properly.
is there, you do one before the other? The gown or mask or gloves? Do you do one before the other or?
Yes.
So I guess whatever's first, do that model and let them practice.
Mhm.
And then at the end of the day, what do you usually do to find out or to assess whether they get the information that you gave them?
So we do check-off sheets, so
Okay.
they have to model that they can put it on and take it off appropriately and follow the steps for infection control.
So the checkoff sheet is something that you do for each kid, or is that individual?
It's usually individual, or I'll take them in groups.
Okay, what about, since the checkoff sheet is not really something, is it graded, something you're gonna grade? Or is it more of a skills check?
It's more of a skills check. It could be a daily grade, but it's really more of a skills check.
So maybe with a checkoff sheet, instead of you doing it, have them do it, the pairs that stood up, have them check each other off. And you can go around, you get a lot more feedback if you go through the class and watch how each one of them analyze the other one. Does that make sense?
Right, okay, I like
Yeah.
that idea.
Yeah, I think that would work. And then at the end of the checkoff sheet, what would you, or what kind of assessment, a true assessment, like a formative assessment, or not a formative assessment, but a summative assessment, what would that look like? That would be how you're gonna test, right?
So, we can go through scenario-based assessments,
Okay.
where they have scenarios and then figure out, what's the best approach.
Okay,
We also do incident reports, so, part of the safety is if there's an incident that happens that's anything outside of the normal procedure,
okay,
like a patient falls or there's a needle stick, we go through, they get scenarios and then an incident report, and they work together in groups to fill out that incident report.
I like that. That's a cool assessment. So, since they've done the checkoff sheet and their skills are good, maybe your assessment's based on a problem, instead of giving them an assessment of the scenario of what are you gonna do or walk into a room, how are you gonna
Mm-hmm.
glove up. Have a scenario of, hey, you're in the room with a patient, they just sneeze blood all over your face or something like that. What are you gonna do? Or you get a needle stick, you know what I mean?
Right,
Give them a problem that they actually have to think through the process of how they're gonna fix, or how they're gonna attack it, I guess, right?
right, okay,
How hard would that be? Do you think that would be tough?
yeah.
Okay. And then, have you done this one before? Do you have any data from last year for this one? On how they did on the skills checks and the assessments?
No, since this is my first year,
It's
then
your first year. That's right, we didn't talk about that. This is our first year.
it's my first year to.
This is also her first, this is her first year to teach.
Yes.
She's been in industry for about 20 years, so all this, the pedagogy and everything, she has an emergency certification, so we're trying to help her get through this. She's doing a fantastic job, by the way. Anyway, does that kind of give you a little bit better idea of how just not to do work through with a PowerPoint?
Absolutely. I like the point of being able to interact with them more.
Right.
Sometimes I feel like I'm just like, more like a professor where,
Right.
you know, we're in lecture hall and so sometimes it can get a little dry depending on what the information is, so.
Yeah, and we know these kids don't like dry.
No,
You're gonna lose them quick if you get dry with these kids.
yes,
So.
yes, they like interaction.
Well, when you do this lesson, I want to let me know so I can come in and I just want to help or just observe and see how it goes and see if my input was good or if we need to tweak it at all,
Absolutely.
change it up. And then maybe if it doesn't go right the first period, maybe you can change it up the second period or something like that. So,
Sure, yeah,
okay.
because I teach 4 of these classes, so,
Okay.
usually first period is my trial run, and then by 7th, I have it down.
That's all
So,
we do. That's just part of being a teacher. Well, thank you, Regina. I appreciate you letting me help you with this.
Thank you, George.